If your neck still hurts weeks or even months after a car crash, even though you were told your x-rays and MRIs were normal, the real injury may have never been addressed. After years of evaluating post-accident patients and reviewing motion-based spinal testing, I have consistently seen that whiplash causes ligament injury, not just muscle strains. Structures like the anterior longitudinal ligament and facet capsules in the neck can be micro-torn during the rapid acceleration and deceleration motion that is caused by a car crash. These tissues control stability and motion in the spine, yet standard imaging rarely shows the damage. When healing is not properly stimulated early, poor collagen repair, chronic inflammation, and instability can lead to persistent neck pain, headaches, stiffness, and dizziness, just to name a few of the symptoms. In this video, I will explain what actually happens to the cervical spine during a whiplash injury, why the first 6 weeks after a car crash are critical, and how SoftWave therapy may help accelerate healing, improve blood flow, reduce inflammation, and eliminate the risk of long-term neck problems. By the end of this video, you'll understand why your pain is still there and why the one overlooked regenerative treatment may be the key to finally healing it properly. Hi, I'm Dr. Jason Nutche. I'm a chiropractor with offices in Philadelphia and Northeast Pennsylvania with over 2 decades of clinical experience treating complex spine, nerve, and soft tissue injuries. I focus on advanced diagnostic testing, especially spinal ligament injury and precision x-ray analysis, because too many people are told nothing is wrong when the real problem simply has not been measured. On this channel, I break down why chronic neck pain, back pain, and headaches persist, explain what imaging can and cannot show, and walk you through modern regenerative options so you can make informed decisions about your health. If you want clear explanations, real answers, and a better understanding of what is actually causing pain and how the body can heal, subscribe to my channel. My goal is to give you clarity, confidence, and a smarter path forward. If your neck still hurts weeks, months, or even years after a car crash, even though you were told your x-rays and MRIs were normal, the real injury may have never been discovered and addressed. Whiplash is often described as a muscle strain. In reality, the rapid acceleration and deceleration motion caused by a car crash places enormous force on the cervical spine. That violent forward and backward movement can stretch and micro-tear the critical stabilizing structures, especially the facet capsule and anterior longitudinal ligaments. These tissues are not minor structures. They act like the spine's internal support cables. They control stability, guide motion, and protect the joints from excessive motion. When they become stretched, inflamed, or destabilized at the microscopic level, the spine can begin to move in ways it was never designed to move. So what does that lead to? Excessive and abnormal motion, chronic muscle guarding, persistent neck stiffness, headaches that seem to start at the base of the skull, pain between the shoulder blades, ongoing inflammation that never fully settles down. Some patients even describe dizziness and a constant feeling of instability. Here's where the confusion begins. Standard x-rays and MRIs are not designed to show bone alignment and major structural damage to the support ligaments. They do not show the microscopic ligament injury. They do not show the subtle instability. They do not show damage inside the facet capsule tissues. So patients are told everything looks normal, even though the stabilizing structures that control motion may still be injured. Have you ever been told your x-rays look fine, normal, but you still have neck pain? The spine contains many spinal ligaments, and these cannot be visualized on x-rays. Research and motion-based spinal testing continue to show that ligament injuries and instability are commonly missed after whiplash trauma. When those tissues fail to heal properly, the neck does not simply go back to normal on its own. And this is where timing becomes critical, because what happens in the first several weeks after a car crash can determine whether those micro-torn ligaments recover correctly or set the stage for chronic neck problems that linger for years. Now, here is the part most people are never told. Time matters after whiplash injury. Many patients are advised to rest, use ice, maybe take medications, and wait. That sounds reasonable on the surface because muscle strains often improve with time and rest. The problem is that whiplash frequently involves ligament injuries, not just muscle tension. Ligaments have a limited blood supply, which means they do not heal the same way muscle tissue does. Ice and anti-inflammatory medications may temporarily reduce pain and swelling, but they do not stimulate collagen repair, restore mechanical stability, or improve blood flow to the damaged ligament tissue. In fact, they inhibit the repair process. In some cases, excessive suppression of inflammation early on may even interfere with the body's natural healing cascade, which depends on a controlled inflammatory response. If damaged ligament tissue is not properly stimulated during those first critical weeks, the body can begin forming poor quality repair instead of strong, organized connective tissue. Collagen is the structural protein that rebuilds ligament injuries. If that repair process is not properly stimulated, collagen can form in a disorganized pattern. The result can be weak scar tissue, reduced tensile strength, and lingering instability in the cervical spine. At the same time, reduced blood flow and persistent inflammation may continue beneath the surface. Microcirculation may not fully recover. The injured tissues may not receive the nutrients and oxygen they need for optimal healing. Chronic inflammation can remain active instead of resolving. What does that lead to over time? Persistent stiffness, ongoing muscle guarding, reduced mobility, chronic headaches, long-term instability that keeps aggravating the surrounding joints and soft tissues. In some cases, what started as an acute injury quietly transitions into a chronic neck condition. This is the 6-week failure point. If healing is not properly supported early, the body may lock into dysfunctional patterns that are much harder to reverse later. Patients often assume that because the pain did not fully resolve in the first month or two, it simply takes more time. In reality, the quality of healing during that early window plays a major role in long-term outcome. Have you ever noticed your neck never quite felt the same after those first few weeks passed? When instability persists and inflammation never fully resolves, simply masking symptoms does not correct the underlying mechanical problem. That is why identifying abnormal motion becomes so important before deciding how to treat it. If the real issue is ligament injury and instability, the next logical question becomes clear. How do you actually identify it? Traditional imaging is static. What this means is that standard x-rays capture a still image of the bones. MRIs capture a still image of the discs and major soft tissue changes. Neither test is designed to measure what happens to the spine when it moves under load. They do not evaluate excessive or abnormal motion patterns that develop when stabilizing ligaments like the anterior longitudinal ligament or facet capsule tissues are compromised. This is where advanced motion-based testing becomes critically important. Cervical flexion and extension x-rays allow clinicians to see how the bones move during forward and backward motion. When combined with a motion analysis system such as SpineCamp, objective measurement of spinal movement at each segment is established before making any treatment decisions. This process identifies whether excessive motion is present at any cervical or lumbar level for that matter, which is the measurable clinical indicator of a ligament injury. It provides a clearer picture of what is happening inside the spine instead of relying on symptoms or patient description. Because if the cervical or lumbar spine is moving too much or moving in the wrong direction at certain segments, that mechanical stress can continue to irritate joints, nerves, and soft tissue. Have you ever stretched your neck hoping it would loosen up only to feel worse afterward? If instability is present, aggressive stretching or repeated manipulation without restoring proper ligament support can continue aggravating the problem. Symptom-based care often focuses on reducing pain signals, relaxing muscle tension, and improving short-term mobility. It does not always address whether the spine is mechanically stable. Masking inflammation does not correct abnormal motion. Reducing muscle tightness does not rebuild microtorn ligament fibers. Without restoring stability, the cycle of irritation and guarding will continue. Research in motion-based spinal testing continue to show that ligament injuries and instability are commonly missed after whiplash trauma. When those injuries are overlooked, patients can move from provider to provider treating symptoms while the underlying instability remains unaddressed. So once instability is identified, the focus must shift. The goal is no longer just pain control. The goal becomes stimulating biological healing inside the damaged connective tissue itself, which leads directly to the treatment most doctors never mention. Once instability and ligament injury are identified, the question becomes clear. How do you actually stimulate healing inside those damaged tissues? Now this brings us to the treatment that most doctors never mention, even though it's been a standard of care in Europe for almost 15 years. It's called SoftWave True Shockwave Therapy. SoftWave True Shockwave Therapy is the original and most clinically validated form of shockwave therapy available today. It is the original electrohydraulically produced true shockwave therapy. It is not a vibration device. It is not a radial pressure wave therapy. It's not a magnetically produced shock wave. It generates true shock waves using electrohydraulic energy, which is the same foundational technology used in lithotripsy that revolutionized medicine beginning in 1980. When lithotripsy was first used to break up kidney stones, physicians made an unexpected observation. After treatment, follow-up x-rays showed bright, dense areas forming in the nearby bones, such as the pelvic bones and the ribs where the shock wave had passed through to get to the stone. At first, there was great concern that it could represent bone cancer. However, biopsies revealed the exact opposite. The tissue was stronger, healthier bone formation. Researchers realized that those shock waves were not only capable of breaking up those unwanted stones, but also stimulating a positive biological healing response in the tissues they pass through. That discovery led to decades of scientific development and research. SoftWave True Shockwave Therapy is FDA cleared for the activation of connective tissue, which includes ligaments. Instead of masking symptoms, it is designed to stimulate the body's own regenerative healing cascade. So how does that apply to whiplash injuries? SoftWave therapy helps modulate inflammation through the immune system rather than simply suppressing it by activating receptors such as toll-like receptor 3 on the cell membrane. SoftWave therapy also activates vascular endothelial growth factor, also known as VEGF, along with other blood vessel growth factors. As these growth factors increase, microcirculation improves. Therefore, nutrient delivery improves. Blood flow to damaged tissues increased significantly, in some cases reported up to 300%. That improved circulation means more oxygen and nutrients can reach ligament tissues that normally have limited blood supply. Also, the contraction and expansion effect it causes on the cell membrane acts like a biological wake-up signal, encouraging dormant and underperforming cells to re-engage in the repair process. Over the following weeks, this supports organized collagen formation, connective tissue repair, and improved mechanical stability. The healing timeline is also important to understand here. Those blood vessel growth factors tend to increase over approximately 4 to 8 weeks over the course of treatment. If you are still dealing with neck pain, headaches, stiffness, or muscle tension after a car crash, please do not give up. You now understand that whiplash is often a ligament and instability injury, even when MRIs and x-rays are reported as normal. You understand why the first 6 weeks matter so much. You understand why symptom suppression alone is oftentimes not enough. And you understand that regenerative options like SoftWave True Shockwave Therapy are designed to activate connective tissue healing, improve blood flow, and support real recovery inside the damaged structures. There are solutions. The key is proper evaluation and the right strategy. If you are interested in SoftWave therapy, take the time to learn more about it and look for a healthcare practitioner who is properly trained and qualified in SoftWave therapy. Make sure they are evaluating for spinal instability and not just treating your symptoms. If you found this video helpful, like it and share it with someone who may still be struggling after a car crash. If you have questions or comments, please drop them in the section below the video. And if you want to go deeper, I have an entire playlist dedicated to whiplash injuries, ligament damage, instability, and regenerative treatment options. Go check out the videos in that playlist so you continue learning and make informed decisions about your recovery.